And I do hope we can talk about stress because, what I was struck by when I was looking at some of the original data on racial weathering, on the wear and tear that happens as a result of the color of your skin. I was so struck by the original data that was collected by a professor at the University of Michigan back in, I think it was 1992. It was a long time ago. What she found when she looked at a number of different populations. She looked at Birmingham, Alabama, Minneapolis, Oakland, California, and Chicago. And one of the things she found is that racial weathering is far worse for Black women than it is for Black men. Now, we could probably debate that because I feel like Black men have their own challenges. We've certainly seen that with George Floyd. I was watching last night about a man from Georgia who was wrongly had excessive force used against him by the police. But I was so struck by the fact that Black women are aging faster, biologically aging faster, certainly than white women, but even more than Black men as a result of racism. So, there's a few reasons for that, and it's not just poverty. A lot of people think this is purely socioeconomic, but what this woman found, I want to make sure I get her name right. Do you know her name? Geronimus, I think is her last name.
Yes, exactly. It is Geronimus, and back in 2006, they were actually studying telomere length. So looking at, yeah, absolutely.
Yes, so I hope we'll talk about telomere length because I think that data is super interesting too. But one of the things she found was that the fastest aging group of people was poor Black women. And the second fastest was non-poor Black women. So I think it's important to realize this is not just socioeconomic. It's much broader than that.
Yeah, so let's talk about it. So you just mentioned that weathering is this accelerated aging, and they measure it, looking at your biological age versus your chronological age. And seeing that Black women are aging faster, meaning you can actually test biomarkers inside of us to see. It's not just, some random assessment of age. So when we think about race and racism and what a Black woman might experience in America, that translates to stress. So, for example, the discrimination that many Black women have experienced in the workplace and not feeling safe enough to speak up. So, for example, with the trauma work that I've spent a lot of time doing, we know that for people who keep secrets, for people who don't feel like they have an ally, some compassionate ally or coach or supporter that they can share with, the more we keep secrets, that is a source of stress. Now, it's not just the being bullied and teased and the outward stuff. It's also what we inflict upon ourselves unknowingly. I mean, nobody, knowingly does this. But there's this intensity that I think we're starting to see unbottled, if I'm honest. Like, I wouldn't have shared my racism experience if it weren't for what's going on right now in 2020. Of course, I share it privately, but I would have never shared it on public, on social media. So when you think about what Black women are experiencing without any outlet, without any safe place to be seen and heard and have it processed, let alone, rectifying the situations, for example, in the workplace, then it's quite obvious to see how that stress can impact us. Now, you've worked in prenatal care and taking care of moms and babies. What do you know about stress and the body and brain, just so that we can start to help people make a connection between how racism can impact us on a physiologic basis?
Yeah, thank you so much for sharing that about secrets, because I think it's a great place to start with this conversation. Thank you, Andrea. So there's so many places I want to go with this, so I'm gonna try to contain myself. I think one of the things you're saying, if I'm hearing you correctly, and tell me if I'm wrong, is that there's a cost to this stress. And the way I describe this to patients is that there's two different types of stress. There's the hormetic stress, the kind of stress that's good for you, the stress that gets you motivated to study for an exam. And then there's toxic stress, the kind of stress that, racism is toxic stress, adverse childhood experiences are toxic stress. And so, with that secret that you were talking about, the first thing that I go to is adverse childhood experiences, because we now have 20 years of data showing that when you experience 4 or more, even 2 or more adverse childhood experiences, and we can get into the details of what those are, they make disease happen in middle age in a way that many physicians are not aware of. And so I think we need to highlight this because women experience more ACEs than men. Mm-hmm. And certainly our BIPOC brothers and sisters experience more ACEs than their white counterparts. So, I'm reading this amazing book by Nadine Burke-Harris called The Deepest Well.
It's an excellent one.
She's our Surgeon General here in California, as you know. And I got to meet her in February, and I just was so struck by I was at an Alzheimer's task force, and she was talking about the connection between adverse childhood experiences and toxic stress and Alzheimer's disease. And if you've read her book, she starts off with this incredible story of a man she calls Evan, who wakes up and can't move. He's 43 years young. He wakes up in his bed next to his wife, who's sleeping soundly, and he can't move. He needs to pee, and so he's trying to get up out of bed, and he can't. Can't move his right arm, can't move his right leg. And his wife later overhears the doctor talking about his case in the emergency room. And you can kind of picture this, us as physicians can sort of hear this, 43-year-old man, stroke, no risk factors. And yet he has this incredible risk factor of adverse childhood experiences. So I imagine you have some things to say about ACEs.
Absolutely. Definitely from my work dealing with trauma. So I don't know that you know this, but before I went full on holistic traveling the world, I ran an intensive outpatient treatment program in the Washington, D.C. area. And we treated a lot of people with obesity, addiction, eating disorders. And it was very interesting to me that creating a holistic environment with everything that you needed. We had psych, we had fitness, we had a holistic spa, acupuncture, cognitive behavioral therapy, everything. And it was also in a very beautiful setting, if I do say. And the majority of our patients, when coming in and learning how the body and brain worked and getting, proper labs and nutrition and all of that, they would just skyrocket. They would just do so much better. But I discovered that there was this subset of our patients that would either sabotage themselves or they would come up with some other addiction or some other thing. And as we started to really investigate why were these other people so successful and the others weren't, we discovered that there were significant ACEs, these adverse childhood experiences. And that's when I really had to dive in and do more training in trauma. So for those of you that are tuning in, and I want to acknowledge you, thank you, Karan, who actually, she says, the Pennington Institute was a movement in and of itself. She actually got to see me there. That's how we met. And Shelley Thomas says that her telomeres were nearly gone when she got tested. And so, and Shelley knows she's been a caretaker for someone with special needs, as happens with us as parents. But for those of you who are tuning in who have never heard of ACEs, just to give you kind of a rundown, these adverse childhood experiences that we're talking about can be several. And if you go to my website or the Innate Vitality website, you can take a little quiz to find out your ACE score. So as Dr. Sara was saying, if you have 4 or more, even just 2 or more of these, there's an increased likelihood that you will develop some of these chronic diseases. And so the adverse childhood experiences that we're talking about, they fall into multiple categories. One is maltreatment, meaning that you were abused. That can be physical, emotional, or sexual abuse. That can also include neglect or abandonment. There's also household adversity, which I believe, Dr. Sara, and I think we should talk about this as well. I think we're going to see people just experiencing COVID and what their parents are going through, from losing jobs, having that financial insecurity. So household adversity, typically we're thinking about things like domestic abuse, which also doesn't mean that you experienced it, but witnessing it. Substance abuse. If you have a family member, a close family member who was mentally ill or being treated for mental illness, if somebody close to the family or in the family committed suicide, for example. There's also criminality, and also for people who've grown up in foster care. So if you've had any of those experiences, and particularly the younger, before the age of 18, we know that that has an impact on our physiology, even down to our DNA. It impacts the nervous system such that even just with COVID, a lot of people saw their stress like go off the charts. And a lot of people ask me, like, why am I so anxious? Like, I've already got enough food and toilet paper. But when you go back and you look at their ACEs and you look at what may have happened in childhood, their nervous system has been tweaked. So when we look at what you're describing, like if you've had some sort of these adverse childhood experiences that have impacted the stress system on the body, nearly all of the diseases that I'm sure you see and saw or treated that had this connection, they're higher. Things like autoimmune conditions, allergies, asthma, arthritis, the list goes on. I'm only in the A's at this point. So yeah, I really feel like every physician needs to be trauma informed, if not even trauma trained.